Now at 5:30, an urgent warning from health experts. If vaccination rates do not increase, the dangerous coronavirus Delta variant could continue to evolve.
The U.S. is seeing a steep acceleration of new COVID-19 cases. According to the White House, the U.S. is on the brink of reaching 100,000 new cases a day. Dr. Anthony Fauci is predicting that number could double and worries about potential future variants.
There is a very long-standing tenet in virology that viruses cannot mutate unless they replicate.
But the message seems to be getting through. The CDC is reporting a nearly 20% increase in vaccinations over the last week, and the Biden administration is ramping up community vaccination efforts, hoping the upward trend continues.
Some good news for those who got the Moderna jab. The biotechnology company announced this morning that the shot is 93% effective 6 months after vaccination. However, this study began 6 months ago. The Delta variant hadn't been circulating just yet. So how relevant are these results? That's what we're asking News 8's medical reporter, Dr. Mary Gillis. Mary, obviously, you've been having a lot of conversations with different doctors.
Many, and this is another interesting one. So, okay, thanks, Alexis. According to the CDC, the Delta variant accounted for approximately 10% of all corona cases back in June. Now that number is up to 83% of cases nationwide and is responsible for 90% of all breakthroughs. The first Delta case was identified in December 2020. The variant soon became the predominant strain of the virus in India and then the UK. Scientists can't exactly pinpoint when Delta landed in the US, but it's unlikely any of the study participants had the variant that is accelerating the pandemic. So is this data useless? I spoke with Dr. Christopher Doering, Vice President of Medical Affairs at Franciscan Health, who says, while we are in a different, more concerning stage of the outbreak, these results are encouraging and should by no means be dismissed.
This is still really strong positive data. And now with the variants that are out there with a longer period of time and literally tens of millions of Americans having received the Moderna vaccine, going forward, I'm sure they'll have additional data to speak to the efficacy against the Delta variant. So anyway, on balance, very positive, very strong performance by this vaccine over that 6-month period.
Moderna's chief executive officer said in a statement today, "I am proud of the progress our teams at Moderna have made in the past quarter in advancing our development pipeline while addressing a global pandemic and quickly establishing global manufacturing and commercial organizations. While the vaccine is showing durability with 93% protection after 6 months, Moderna does recognize Delta is a significant threat. The company says it will continue to remain vigilant as it continues its research."
Mary, obviously the Delta variant is here. I know that this study has only been going on for so long, so we're not exactly sure what that relationship looks like. But have you been able to talk to Moderna about if they need to adjust what they're doing just yet?
Well, in terms of what we know now is what we associate with the coronavirus is that spike protein. So if we have variants that come, all we have to do with the vaccine companies is target that spike protein. And because we have this technology already, we know how to do that very quickly. So Moderna and other pharmaceutical companies are very confident that they're going to be able to handle this Delta variant.
Mary, thank you.
Thank you, Alexis.
Ladies, thank you. More children may have developed nearsightedness as a side effect of COVID-19. That's according to a new study out of Hong Kong. It looked at nearly 2,000 children ages 6 to 8 years old. They were divided up into two groups, around 700 in the COVID-19 group and the rest in the pre-pandemic group. That was studied over 3 years. Researchers found 1 in 5 from the COVID-19 group developed nearsightedness. Compare that to the 1 in 3 from the other group. The researchers implicated an increase in screen time and a decrease in time spent outdoors for the rise in nearsightedness. While the number of people who applied for U.S. unemployment benefits at the end of July fell close to a pandemic low. Jobless claims dropped by 14,000 to 385,000. Applications had surged to a 2-month high in mid-July and have fallen steadily since topping 900,000 in January. Before the pandemic, they were coming in at around 220,000 a week.